Okay, let's talk about the walk. So first of all, I think there were probably a couple of things. There were some things that were really good about what we just did and what we saw, and there were some things that we could have maybe improved on.
Yep.
So without thinking about the gait analysis, first of all, tell me if there's anything that you would have done differently next time. Was there anything about the walk that you would have liked to have done differently or changed?
With when walking with him?
Yep.
Yeah. I don't know.
Don't know. Okay. What about when Barry came to sit back down at the end?
Yeah. I probably would have instructed him more to put his hand down onto the wheelchair to sit down and make sure he was straight before he sat down. And yeah, I mean, I did end up putting a hand on him, and I don't know whether he really needed that. I think he just needed some more instruction as to his alignment with the wheelchair.
Yep. Yeah, but it's something to watch, isn't it?
Yeah, and his foot positioning as well, I think.
Yeah.
Yep.
Yeah. Okay, and it would have been nice to see him without shoes as well, but we're a bit time limited and he walks with shoes on the ward, so I think it's appropriate to see him like that.
Yep.
But it would be nice to see what it's like without shoes.
Yep.
If we had more time. Okay, and again, we're a bit limited with time and our surroundings, but are there any objective measures that you would have liked to have done?
Yeah, I would have liked to have done the 10-metre walk.
Yeah.
Because he is supervision, I think he would have quite easily managed to do that, and we could have taken some measures from that. And the timed up and go as well, just because he's able to get in and out of his wheelchair as well. So.
Okay, and is there any reason why you particularly choose those two measures? Is there any evidence base, or are they particularly valid or reliable for the clinical population that he fits into?
Yeah, I don't know like the exact details, but I know that definitely for like timed up and go within the population and the age group, it is quite a valid measure of I think also balance and gait. So it sort of does two things in one.
Yep. So that would be good. Okay, right. Well, that leads me into the next part of what we need to talk about. So Barry's goal is to be able to walk independently to the toilet using his stick. And we just saw he can certainly walk that distance in an average house, can't he?
Yep.
But he's needing supervision at the moment. Now, he wants to walk independently. What's stopping him from being independent? So why would you feel confident to let him walk independently at the moment, I guess is what I'm asking?
No, I wouldn't. Just by the way that he's walking and just the way he carries himself and that kind of thing, I don't think it would be appropriate for him to be independent.
Okay, so what would you be worried might happen?
He'd be a high falls risk, I think, especially if he was in an environment where there was a lot of clutter, things in his way, and having to manoeuvre around different surfaces and things like that. I don't think it would be terribly safe.
Okay, yep, so we need to make his walking safer.
Yep.
All right. So potentially we could assess his balance, but we're not going to do that.
Yep.
We're going to talk about his gait, aren't we?
Yes.
So tell me some of the things you picked up
All
about
right.
his
So
walking.
some of the main things that I noticed were that he had, most notably on his right side, so he had reduced heel strike in stance face of walking. He also had reduced hip extension through the stance and like toe off phase. He also had increased external rotation of his right hip, so it was really turning his foot out when he was walking, so that also made heel strike quite difficult for him. Some other notable things was that he had reduced arm swing of his right arm, but he was holding the 4-point stick in his left, and just some of the things like we just discussed about his requiring supervision and that kind of thing. So they were some of the main things that I noticed with his gait.
Yeah, okay.
Just had a quick look, Yeah,
and I mean, I think he was trying really hard to get heel strike, wasn't he? And
yes.
a lot of the time he did actually
I could tell he was quite conscious of doing that, and it's obviously something he's been aware of himself.
That's right, but did you notice him catch his toe a couple of times in swing? Yeah, so although he might be getting heel strike at the end, it might be that he's not getting toe clearance through swing. Yeah, okay, so we're going to pick one of those points apart. So which one did you want to look at
Well,
today?
I guess I'll just start from sort of the bottom and go for the reduced heel strike, or...
Okay, yep, all right, that seems fair, because that's really part of why his walking's not safe, isn't it?
Yep.
So tell me what you've sat down just previously and written
Yep.
out some of the contributing factors. So
Yep.
what would some of those
So
be?
I would say obviously his ankle dorsiflexors could be weak and
Yes.
not activating that dorsiflexion. He could have increased tone in his gastrocs or also a reduced muscle length in his gastrocs, which is keeping the foot either neutral or in plantar flexion. He could also have some sensation problems with the foot and the ankle, and also proprioception with the ankle joint.
Yeah.
And they were sort of the main things that I would think may be contributing to that reduction.
Okay.
Yeah.
Yep. What about pain?
Oh yes, it could be painful, or it could be in that particular position. So dorsiflexing the ankle could initiate some sort of pain response, and he may be sort of avoiding that.
Yep. Okay. All right. Well, we might go and get Barry again.
Okay.
And we'll have a look at some of those points, and we'll see what we find, and then we can go on and do some treatment.
All right. Wonderful.